Welcome back to the channel, y'all. If you've never been here before, go ahead and hit that subscribe button, please. Click the bell next to the subscribe button so you are notified every time a new video goes up on SoFlo TV. I am your host with the most. This video is another US immigration update with important information that might affect you or someone you know. We ask you to pass the video around by simply sharing it. Knowledge is power. There is a new Trump directive that could deny more visas based on an applicant's health and their finances. Now, before I even get into the information, it really makes sense to a lot of people, right? That America does not invite into its space the brokest people in the world and the sickest people in the world for obvious reasons. They will come and become a liability and not an asset. Washington News says a new directive by President Donald Trump's administration could make it far more difficult for foreigners to visit or even live in the United States of America if they have certain medical conditions, such as diabetes, or get this one, obesity, or lack of economic resources and assets to support one's self. Now, you know they are raising the bar very high as far as proving economic resources and assets to support one's self. Before, it was looking like what was 30, 40, $50,000 a month, a year. And now it's probably looking like you're going to need to be one of the high earners in order to enter or to stay. So the guidance issued last week in a cable from the State Department was obtained by major news media houses and has now been put out to the public. It directs embassy and consular officials to comprehensively and thoroughly vet visa applicants to demonstrate that they will not need to rely on public benefits from the government anytime after their admission into the United States of America. Experts say that it could further limit who gets to enter the country at a time when the Republican administration is already tightening those ropes. Now, this is not new. This has always been around. However, they are raising the bar higher, and you will be required to prove more. They are required now to enforce it more, and those on the outside looking in, wishing to come in, will have to show far more resources and also now be in much better health. Imagine someone saying you are too fat to make it to the United States of America. You will not be allowed in because you are considered to be obese. Obese, we're not talking about 500 pounds. Obese starts after your BMI hits a certain level. So there are people walking around right now who do not think they are obese, but the doctor will tell you that you are on the obese side. The directive reveals how the Trump administration interprets public charge. The concept in immigration law that foreigners can be refused entry or even permanent residency status if they are likely to rely on U.S. government resources, such as certain types of cash and food aid. You're here in the United States of America, you're on a visa. You've worked on your visa for quite some time, you are perfectly legal here. You decide to go the legal route and try to have your status adjusted from a worker on a visa or visitor on a visa to a permanent resident. You will now have to go through, are you fat enough or not fat or fit enough to be allowed to have your status adjusted? So While federal law already requires that those seeking permanent residency or legal status that they have to prove that they would not be a public charge, Trump, in his first term, widened the range of benefit programs that could disqualify applicants, and the guidelines in the cable appears to go even further in scope. In other words, for those of you who've been here for a while and you've been on your green card, where your green card has certain restrictions to it, like you cannot stay outside of the United States of America for over a year without special conditions and a waiver, or that you are not supposed to be collecting certain benefits that are available to citizens who are going through hard times or who are disabled, certain food benefits, certain medical benefits. If you've been collecting those, then the Trump administration is going to be clamping down on you when you go to adjust your status from that green card over to becoming a citizen. Keep in mind that each green card holder never really wants the green card, because the more secured position to be in is to actually have full citizenship. Then you can stay out the country for as long as you want to, travel as much as you want to, come back when you feel like it, among other perks that are available to citizens that are not necessarily available to green card holders or permanent residents. So this could lead to a substantial narrowing of immigration, said Julie Galat, who is the Associate Director of the US Immigration Policy Program at the Migration Policy Institute. The Trump administration is trying to go back to the policies that it worked to implement in its first term related to public charge. Now, this new directive goes even further on health requirements. It makes sense that you also keep yourself in good shape if you are a green card holder. Don't come to the United States of America, start eating up all this junk food, start getting fat, and then your diabetes kicks in, and then your body is just wobbly and out of shape, and you are not fit to fight. You better stay in good shape, because again, it's going to look weird if this actually happens, but it will be the law of the land. If it goes through, that law of the land will say when you go to adjust your status from green card holder to citizen, they will definitely be looking at your fitness level. If you are full blown diabetic, if you became ill with other illnesses that will be placed on that list, if you are severely overweight, and if you are broke and cannot sustain yourself financially, they will most likely keep you on a green card, allow it to expire. There's a time when you have to renew a green card, and they will then choose if they want to renew it or send you packing. Easy. So, since returning to office in January, Donald Trump has pursued a government wide immigration crackdown that has involved tightening the rules on foreigners being let into the country and those that are already in the country as well. Immigration policy experts say that the latest guidance could reduce the number of immigrants and non immigrant visas that are granted, and could disproportionately affect some groups of foreigners who are seeking access to the United States of America, such as older adults and people from places with low incomes. The cable was sent from State Department headquarters to every US embassy and US consulate around the world. Hmm. Wow. So everybody is on notice that in their country, they should start vetting using this cable, this list. The cable was sent from the State Department headquarters to every U.S. embassy and U.S. consulate around the world. The Trump administration is putting the interest of the American people first, is what State Department spokesman Tommy Pigott said on Tuesday. This includes enforcing policies that ensures our immigration system is not a burden on the American taxpayers. A lot of people are going to agree with this for obvious reasons. If you come into the country and you are let in and you are broke, then most obviously you're going to need some assistance for housing, food, shelter, whatever. You want to look at healthcare reasons. If you come in, if you're let in sick, then who's going to pay your medical bills, right? Man, they are really, really being picky. Immigrants who are seeking to enter into the United States of America, they already undergo a medical exam by a physician who's been approved by a US Embassy. I didn't know that, but that's what it is. The immigrants who are being let in have to go undergo medical examination, and those doctors or physicians who do these exams for that particular reason have to be approved by the US Embassy. You know what that means? It means you can't go get your favorite doctor who is also your homie and have them doctor your paperwork so you come in fit and fine even though you're full blown diabetic, right? They are screened for communicable diseases like tuberculosis, and they're asked to disclose any history of drug or alcohol use, not abuse, use, mental health conditions, or involvement in any violence over the period of your lifetime. They're also required to have a number of vaccinations before being able to enter the United States of America or before being able to consider eligible to enter the United States of America. So the new directive goes even further with more specific requirements. The cable says consular officials must consider a range of specific details about people who are seeking visas to enter the United States of America, including their age, health, their family status, their finances, their education levels, what skills they have, and any past use of public assistance, regardless of whatever country you were in. Were you in Jamaica depending on the government to help pay your bills? Were you in France depending on their system? Were you in the UK living off the dole? It also says that they should assess applicants' English proficiency and can do so by conducting interviews in strictly English only. Uh-oh. You know, over the years, one of the things that I noticed that changed with the United States of America is when I first came here a long time ago, everything was done in English. And then over the years, I started seeing Spanish. And even in some places in the United States of America, it is not so much a requirement, but if you are not bilingual, as in English with Spanish specifically, you more than likely will not get that job. So now the Trump administration has passed this out to all the consulates around the globe, American consulates and embassies, saying that everything must be conducted in English. And that is one way of vetting that every person who tries to come into the United States of America is proficient at English. They don't care about your Spanish. They don't care about you being bilingual. You can speak French and English and whatever else. They just want to know that you are top of the line in English. Experts are now saying that that directive could broaden who gets denied for a visa. Well, obviously, now there are a list of things. So if your English is bad, if you're from a poor family and don't have enough money to meet their requirements to prove that you won't need any help when you get here, if you are out of shape because they just added obesity to the list, and if you have any pre-existing medical conditions, all those will now determine your rejection or your approval. So among the medical conditions that could disqualify a visa applicant are chronic conditions. This is the list. It says obesity, Obesity does not mean you're 400 or 500 pounds. Obesity is now on the list. High blood pressure is now on the list. Cardiovascular issues is now on the list. That is pretty broad, but cardiovascular issues is on the list. Metabolic and neurological diseases now on the list as well. Get this. Depression is on the list. Anxiety is on the list. Mental health conditions that can require hundreds of thousands of dollars worth of care is how these are labeled on that list. So if you fall in between any of these, you are not going to be able to secure a visa to enter the United States of America in any way, shape, or form in the near future. It also tells consular officials that whenever an applicant is seeking to use finances to satisfy public charge requirements, they should request to view that person's bank accounts and all their financial documents. Their evidence of their assets must also be presented. Checking accounts, saving accounts, brokerage, trust funds, retirement accounts, deeds, mortgage. They want everything. Although the guidelines primarily impact people outside of the United States of America or those who are seeking to renew their visas who are already here, some experts warn that this could also affect family members of people who are already living in the United States of America who would like to come to visit or to live with their families who are already here. Adrian Cadena, executive director at Protecting Immigrants' Families, said that the policy is dangerous and the policy impacts immigrant families living legally in the United States of America already. Because if you are on a green card and you've already satisfied your required time to be on a green card and now you're trying to adjust your status to citizen, you are affected also. Imagine going to adjust your status from a green card holder to a citizen only to be told you are rejected because you are overweight or you are considered to be obese, or you have developed diabetes or any kind of other ailments that are on that list, or you have not been making enough money or have enough money saved to show that you will not at some point in the future become dependent on the system. So therefore, you will have to stay with your green card. That's a form of control because a green card needs to be renewed at some point. And at some point, they could decide, we don't want to renew your green card anymore. Just pack it up and go. Kind of nerve-wracking situation to be in. So you have to make sure that you're making good money. You got to make sure that you stay healthy. That's a lot to think about, right? It's reported, Brett, the secrecy drive confusion and concerns that deter lawfully present immigrants and U.S. citizens in immigrant families from getting the help and the care for which they qualify under the federal law, says Cadena. Y'all know Trump don't care about any of this stuff, what advocate groups say. It seems like we're at a place where the president can do absolutely everything he wants to do, and he's been proving that to us. So, U.S. officials that are familiar with the new guidelines said that the change applies to immigrant visas and not to non immigrant visas known as the B2s, which allows for short term stays that include personal visits and medical treatment. Much discretion is left to consular officers to interpret the guidance as they see fit. Immigration attorney Stephen Heller said, but he added that the guidance represents a message shift from approaching visa applicants in a favorable light toward considering all circumstances to find a reason to deny, deny, deny. The new guidance is about messaging, he said. They are being given clearance to use the totality of the circumstances as a sword rather than as a shield. That's the latest on U.S. immigration update concerning visas It's getting more and more sticky out here. These were things that were suggested during Donald Trump's first term as president, and he didn't quite get to finish them. And now he is definitely working at making sure they become the standards. Leave your comments in the comment section below. Tell me what you think about this one. I'll catch you on the next video. It's SoFlo TV. I'm out. Peace.